Well, I hope everyone's having a fantastic Thursday and having a great afternoon and morning wherever you are. Welcome to the Facility Compliance Think Tank presented by Soleran. My name is Mike Foley. I'm the Vice President of Strategy and Business Development here at Soleran, and I'm the moderator for today's webinar. So this is our final webinar in our spring three-part series, and today's topic is a great one: new emergency and water management standards, and what do they mean? So our webinars really do serve two purposes. One is we really like to talk about best practices in the area of facilities, life safety, emergency preparedness, security, and other compliance-related topics. But also this webinar really serves an alternate purpose, and it just helps our healthcare professionals network together, share best practices, and share ideas. So let's get started. I'm going to introduce today's panelists. So first we have Taylor Vaughn, and Taylor serves as the facility manager at Children's Health. She oversees the system-wide facilities related regulatory compliance and a content writer for Legacy FM. She's also the Region 5 director for TAFM. And she's also served as ASHRAE's Diversity Task Force member and is the ASHRAE member Tools Task Force. And next we have Billy Kinch, and Billy is the lead facility specialist at the Center for the Improvement of Healthcare Quality, or CIHQ. He's been a facility specialist surveyor at CIHQ, and he's been there for over 7 years. He developed CIHQ's Healthcare Accreditation Certified Professionals in the Physical Environment Certificate Program, or the HACP PE. He's been in healthcare for over 20 years. He's also served as a safety officer and a disaster preparedness coordinator in the hospital setting prior to coming to CIHQ. He's got a master's degrees in healthcare administration from the University of Phoenix and a bachelor's in education from Wayland Baptist University. And then finally, we have Lance Woolf. He is the director of life safety compliance here at Soleran. He's a former life safety code surveyor for the Joint Commission. He's been 17 years in hospitals at the director and senior director level. And during that time, he oversaw engineering, emergency preparedness, safety, biomed, security, and environmental services. Well, first, I just want to thank all of our speakers for taking time out of their busy schedules to join us on this really important topic. And this is guaranteed to be a great hour for everyone. And I hope we all walk away with the best practices and some key learnings. So just a couple of housekeeping items before we get started. So the format of the webinar, we have roughly 10 to 15 minutes for each of our speakers to present using PowerPoint slides. And we just highly encourage you, if you like what you see on the screen, you'd like to take a screenshot, go ahead and do that. And also feel free to use this webinar as a reference. After our speakers have presented for the 10 or 15 minutes, then we go to the live Q&A session. And honestly, this is where a lot of the goodness comes from. So this is what we ask is use the QA button at the bottom right of your screen to ask your questions. If that toolbar disappears, just go ahead and scroll your mouse over it and it should reappear. One of the last slides in the presentation will have more information about FCTT so you can utilize this facility compliance community network in the future, as well as get in touch with Soleran after the presentation if you have any questions. You're also going to receive a follow-up email with today's recording and a complimentary solutions for your facility. And be sure to take a minute and fill out the quick survey at the very end of the webinar. It gives us some great ideas for the future webinars to serve you better. So let's get started on the webinar. Taylor is going to kick it off and talk about her water management plan, rounding areas she is identifying and how she does her program. Taylor, take it away.
Hi, everybody. Thank you for joining us today. We'll go to the next slide, please. So first, I want to just give you some background about Children's Health, where I work. What I'm going to show you today is actually our water management plan, what we present to surveyors. So Children's Health is made up of 3 hospitals. We're about 600 beds total. We do have one large hospital in the heart of downtown Dallas, and then another just a little bit north in Plano. And we made a water management plan for each campus, and that's something that surveyors have really liked. They've asked about because depending on the location, you're going to have different patient populations, different services, and different quality of water coming in from your city. So I want to stress that you need to have a different plan for each building. And next slide, please. So along with that is the requirement to have a designated team. And we kind of found that, when we first made our water management plan and we had a designated team for each campus, it seemed to be a bunch of the same people because we have a lot of system employees. So we actually combined our team and we have one team for each campus. But when we meet, we still review the different buildings on its own because, again, they do have different aspects to each building. But I included some of the people that we have on our team. The water management plan was never intended to be something created by the engineering or facilities manager in silo. You've got to have people on your team from across your organization. So we've got EVS, obviously infection control is a big one. They always ask about, do you have representation from infection control on your team? And we took it a step further. We have a clinical infection preventionist as well. So we have two different sides. Another one is dialysis. There's some equipment in dialysis that affects the water system or can be affected by it. We included accreditation, so we're always in compliance. Don't forget about your ambulatory buildings or business occupancies. Those are included now as well. And we also included our friends from planning, design, and construction. Next slide, please. So the plan components, when we sat down and we started writing it, we realized there wasn't a lot of extra stuff we needed to do for our water management plan. We already PM our chillers, we PM our air handling units, ice machines. So all we did was take those components and add them to our plan and just do a little narrative about how we maintain each piece of equipment. And do not forget about your decorative fountains and water features. We went through a mock survey with JCR about a month ago, and that was one of the specific questions they asked because the surveyor had seen a little water feature that we have out front and asked if it was in our plan. Thankfully it was. We had identified it and we were able to speak to that we chlorinate it as needed, and because it does aerate water. So he wanted to make sure that for those that were standing by the fountain, it was safe for them. So another part of the plan is to identify your patient populations. The surveyor is going to want to see where you have those patients that are really high risk, patients that are, organ transplant, bone marrow transplant, oncology, those really high risk patients. And they want to see that you've identified where they are and noted them in your plan. So we have a stacking diagram that shows each level of our building where each department is housed, and we've highlighted those areas of high risk. And we made sure to identify points in the water system near those areas that we could test annually to make sure that water is extra safe. Another thing that they wanted to look at during our recent survey was how we dealt with areas of closure or building that would be closed for an extended period of time. We actually went through that during COVID. We closed a bunch of our smaller offsite locations that do therapy services. We closed them for about 6 or 8 months. And we had a plan in place. We went in weekly, flushed all the water. We still PM'd our equipment, and we were able to speak to that. And that was how we showed, we do have a plan for that. But we also wrote it in our policy as well. If a building or an area is going to be closed, we will go in and we will flush that water to make sure it's not stagnant. We'll go to the next slide and look at our water system diagram. So this is another part of your plan that you're required to have. They want to see that you know how water flows into your building and how it flows through the equipment and then how it ultimately is eliminated from your building. When we first did this, we tried to put, specific cooling towers and specific ice machines and specific boilers, and it just got too big. It was too huge. So we kept it really simple and just basic. And so far it's worked well for us. So don't go overboard with this. They just want to see that you know your building, you know what equipment you have, and you know where your high risk points are. So for us, that's going to be cooling towers, boilers, hot water tanks. So we test those annually. We'll talk about that in just a little bit. Next slide, please. Another really important part of your plan is your risk assessment. So our designated team, we have chosen to meet semi-annually. So in one of our meetings, we review the annual risk assessment. And that just is a way to show you've realized, or you've documented what's in your building, what the level of risk is, and that's how you formulate your plan. We'll go to the next slide and actually look at our risk assessment that we use. So this is what we actually show to surveyors. They have never had any issues with this. There's not a lot to it, but it really gets to the point. So this is the one we did last year for our Dallas campus. You know, we identified the type of water we have, the temperature, and then any risk factors we have. So we do have a couple of dead legs that we identified. We do have water softeners. Sometimes we close buildings for construction or other things like that. And we highlighted those things. So based on that, we said that this building has some level of risk. And we presented this to our designated team, and they approved it. One thing that the surveyor did want to see in our last survey is he wanted to see the meeting minutes and where it actually showed that the committee approved this risk assessment. So make sure when you have your meeting, you document the minutes and you say that this risk assessment for this year was approved by the committee. He wanted to see that word for word. Next slide, please. So you don't have to test your system for Legionella or waterborne pathogens. If you test it, you're probably going to find it, but that's up to you. That's something you and your designated team need to decide. We have chosen to test our system annually. So what we did, we worked with our water treatment vendor, and we went through our building and just identified, you know, not only areas of high risk like the boilers and the cooling towers, but those areas that could potentially be dead legs. So we decided that we are going to go in weekly and flush those areas. We turn the water on for about 5 minutes. It's either, you know, a sink or a shower in a patient area, sometimes patient room. And then annually, we decided we're going to test those areas. So far, we have found a little bit. It's always in the hot water tanks. So that's, you know, kind of to be expected, but it seems that our plan of flushing those higher risk areas in the patient care areas has been working because we have not found it in any of those areas. So figure out with your team where you want to test, how often you want to test. It's up to you. And next slide, please. So another part of your plan, you've got to, you know, document what you're going to do if you do find it, because you probably are if you decide to test. Make sure you have a, you know, a limit that you're going to base your plan off of. If you find this much growth or this much Legionella or waterborne pathogens, then you're going to do something. Don't just do something because you find it, because you're probably going to have that limit that you decide with your team, and make sure you write that in your policy, make sure you follow your policy, and then make sure you document each step. If you do find it, you do remediation, you have to retest showing that the area is clear, and you have to document each step. And I think that's it for me. Thank you, everybody. Please feel free to email me if you have any questions.
Taylor, that was fantastic, and I greatly appreciated your perspective, especially just coming from a current facility manager and dealing with all of these changes that's happening right now. That was great information. And right now, we're going to turn to our next speaker. Billy is going to give us the perspective from CIHQ and what the surveyors are experiencing on these new standards as well. Billy, go ahead and take it away.
Thanks, Mike. Appreciate it. And good morning, good afternoon, wherever you are currently located at. Hope you're having a great day. So let's get started. Next slide, please. All right, some of you may have never heard about us. Who in the world is CIHQ? So just wanted to give you a brief description about who we are, what we do. So CIHQ actually opened in 1999, and it was originated as a consulting service. Over the years, our CEO thought it was a prime time for another accrediting organization to make a presence. And so he started the process of becoming a deeming authority with CMS. And so that actually occurred back in 2013. So we have now been an accrediting organization for 9 years. We still are the new kids on the block, but we are one of the 4 accrediting organizations having deeming authority for hospitals. We currently accredit 130 hospitals all over the country, steadily increasing every month. Out of those 130, 114 of those use us for deeming status. We also will accredit some freestanding emergency centers and congregate living healthcare facilities, and we have approximately 40 of those also around the country as well. As mentioned earlier, we actually have a certification called the HACP, or the Healthcare Accreditation Certified Professional. It was originally started as an accreditation for individuals just who are in the accreditation world. Just this past year, we also included a physical environment component of that. So if anybody's ever interested in that, take a look at our website and find out any information that you may have on that. Next slide. All right, so CIHQ, this is what our standards are. So all the 4 accrediting organizations are going to have maybe a little bit of different information, but overall the same concept. So these are our standards out of our rules and regs. So the first one is that the organization will implement a water management program, and this is something that considers the ASHRAE industry standard and the CDC toolkit. And this will include control measures such as physical controls, temperature management, disinfectant level control, and visual inspections and environmental testing for pathogens. So this is the overwhelming component, the starting process of this water management standard. Next slide, please. Our next requirement is that the organization conducts that facility risk assessment to identify where Legionella or any other opportunistic waterborne pathogens may grow and spread in the facility water system. So first one's the plan. Now we got the risk assessment. Next slide. And then the organization will specify testing protocols and acceptable ranges for the control measures and document the results of testing and the corrective actions taken whenever control limits are not maintained. So these are what our standards are, and these are new to us. Not that we've never looked at it before. Where we had it before was under our infection control standards, and it wasn't very prescriptive. So we just recently changed the location of where these standards were required, and now they're under our care environment. And this is actually what it states now. So it's a little bit more detail, a little bit more information. So on the next slide, we're going to talk a little bit about what you would expect from us as we come on site. So one of the things we do is we will let organizations know we have a list of documents that we want them to have prepared before we ever arrive to their facility. And one of those documents is going to be your waterborne pathogen or water management policy, and then also that risk assessment. So these are going to be things that we look at on day one, the first morning that we get there. So what we're going to do is we're going to review that risk assessment. And just like Taylor had talked about as well on that risk assessment, it needs to have the pertinent information. We want to see where the water's coming into your facility. And I totally agree with Taylor. Don't make it that difficult. If it's cumbersome for you, if it's if it's confusing to you, it's going to be confusing to us as well. So you know your system a lot more than we do. We just want to make sure that you are assessing and looking at all of those components. Then we're going to take a look at your policy. And so these are the main 2 things that are required from CMS. Is number 1, that you have a policy, number 2, that you have a risk assessment. And then each organization is going to be different. So there is not a one size fits all when it comes to these policies and when it comes to the risk assessment. Every hospital is going to be different. Taylor's was very complicated, comprehensive. She's got multiple different locations and buildings. Some of you may only have one, so some people may be a little bit more complex. So as we're going through the policy, that will dictate some of the questions that we may ask. And a lot of you will have testing requirements as a result of that. So again, just like Taylor had mentioned, there's nothing that says thou shalt test for Legionella. It's just based upon your risk assessment. But if you say you're going to, then we're going to ask to see that. So we'll look for any of those testing results. And then from those results, we're going to see, do you have any actionable levels? So did you state that if this water detects Legionella or something else at a certain level, that this is when we're going to act? So we're going to look at that. And then whatever that actionable level is, if you do attain that actionable level, we're going to make sure that you actually did something about it. And then once you did something about it, did you retest it to make sure that it didn't fail below those actionable levels? So those are the things that we're going to be looking at. And it's anything and everything that you state that you're going to do. Some policies and plans we've seen have gotten very detailed, very specific as to where they're going to pull the samples from. So if yours has that level of detail, just understand that that's what we're going to ask for. And then once we've looked at all those, obviously then during our building tour, we're going to go around and see if there's anything that you may have missed. So I know that Taylor mentioned she had a consultant come in and they saw a water feature outside and they wanted to make sure that that was addressed. So as we're walking around, that's when we're going to possibly identify areas that you may not have thought about and we didn't see that was included into your plan. So these could be closed areas. It could be just floors that aren't utilized. You got rooms that aren't being utilized anymore, things like that. So then that's when we're going to go back to your policy and make sure that, and your risk assessment, and make sure that everything was addressed. So overall, it's not a complicated process whenever we're looking at it. The more complicated, the most complicated component of this actually falls on you as the organizations to have to do all of this stuff. When we come and assess, it's not that complicated. We're just going to make sure that you've done it and you're following exactly what you state. So that's it for the water management. So the next slide, we're going to start talking about emergency preparedness and disaster preparedness. So the overall topic of this was to talk about new standards related to the water management and the disaster preparedness. Just because one accredited organization has new standards doesn't necessarily mean that they all do. So it's a lot of times this is dictated by something that has come along from CMS. So we actually haven't had any updates to our disaster preparedness standards since CMS came out with the new requirements for the disaster preparedness. So that was the first change that we had. And then it was a couple of years later when they had another update, and it was mainly on the timing of all of these components, as far as how often do you review your disaster plan? How often do you do training? How often do you review your policies and procedures, the communication plan, and things like that? That was changed from every year to every 2 years. And so we updated our standards to do that. So you will notice if you ever go in and look at our regulations, we are almost 100% based upon CMS regulations. So we mirror those pretty close, because ultimately we have to meet and abide by the CMS conditions of participation. So that's exactly how we write our standards. There's a few things that we go above and beyond, but overall, that's exactly what we do. So when we look at a hospital for disaster preparedness, you will see the things that we're looking at. So the first thing we look at is that disaster plan. Do you have an all hazards approach disaster plan that no matter what type of disaster happens in your facility, your plan can actually manage it? It's very high level, not a very detailed type of plan, but just a very high level. We're going to make sure that it was based upon a hazard vulnerability analysis, and actually 2 HVAs, so one community-based and one hospital-based. And we want to see how you utilize the community in the development of yours, and vice versa, how you were involved in the development of the community HVA. So we want to also see that you are participating in healthcare coalitions and have a presence in the community. Then we're going to take a look at your policies and procedures, and these are going to be things that are a little bit more specific, more detail oriented. There are a list of policies and procedures that you're required to have, and again, to make sure that those are updated every 2 years. And then the communication plan we'll take a look at, make sure that you have everything is current. You have the contact information of people that you may have in a contract, people within your community, your employees, your physicians. Do you have backup communications in place? Components like that. And then your emergency, or I'm sorry, your training and testing program, your training, again, it's once every 2 years. The hospital gets to determine what it is exactly that your staff are trained on, but it does have to be specific to what their job duties are. So a lot of people during a disaster, they're going to do their normal jobs, irregardless of whether or not there's a disaster or not. So those individuals can receive just a very basic and overall understanding of what emergency preparedness is. But then you're going to have others within your organization that are going to have very specific roles and job duties. So those are the ones that we really want to focus on to make sure that they are trained on what their expected roles are. And then the testing program, again, we require 2 exercises a year. One is a full-scale community-based, and then if you cannot participate in a community-based, we want to know why. So maybe your community just didn't have one. So in lieu of that, you can do a full-scale hospital-based. The second one can be another full-scale community-based, a full-scale hospital-based, or it can be a tabletop exercise. Provided that you follow all the key components for a tabletop exercise, we will allow that. We'll take a look at your emergency standby power systems, make sure they were installed and implemented according to NFPA 99 and NFPA 110 standards for that. So existing, you have what you have. Anything that's new, we just want to make sure that those are installed to those new requirements. If you are a healthcare system, we're going to take a look at that. We do allow healthcare systems to have system-wide policies, provided that certain components exist, and that's going to be for each individual organization is going to have an HVA. If there are different responsibilities or responses for a different hospital, those have to be pointed out as well. And then we'll take a look at the transplant centers, if you have one, to make sure that they are included in your team. So that's kind of what we're looking for and our expectations when we go and look at a water management plan, and then also disaster preparedness. So I believe that's all we have. So next slide. Again, if you have any questions, please feel free to reach out to me. I'd be happy to talk to you.
Hey, Billy, thank you so much for being a presenter today and presenting your organization's perspective on all these changes and how you're tackling those things. So we greatly appreciate it. Now we're going to go over to Lance, and he's going to give us a perspective from the Joint Commission Surveyor's perspective on all these new emergency and water management standards. Lance, it's all yours.
Okay, great. Well, again, good afternoon, good afternoon, or good wherever you're located at in the States. Thanks again, Mike, for the handoff. And we're going to go ahead and talk about, just give a little bit of history, talk about some of the changes with Joint Commission in regards to your water management plan. And then we're going to end it with some of the changes that are coming up with emergency preparedness as well. So first, let's talk about a little bit about the history of Legionnaire's disease. And it came back where it was actually discovered back in 1976 at an outbreak, and it was identified at the American Legion Convention in Philadelphia. Hence the reason why it's called Legionnaire's disease is because the American Legion Convention is where they actually identified this. Legionella or Legionnaire's disease is also a form of Pontiac fever. Those two are very closely related, but between the two, Legionnaire's disease is the more acute of the two. Legionnaire bacterium, it's compared to pneumonia. So you're going to have aches, shortness of breath, severe cough, fever, but it's very hazardous to individuals with compromised immunity. And Taylor talked about this specifically with your water management plan. If you have patients that are in the area that have compromised immunity, you're definitely going to want to identify that in your water management plan and focus in those areas where you do have stagnant water. Because with that case, out of 4 patients, Joint Commission did a study last year. Out of 4 patients that were identified that had Legionnaire's, and if they had a compromised immunity, 3 of those were severely affected by Legionnaire's disease when that transmission happened. Legionella is also a bacterium that resides in water, and it's not just stagnant, and that's where some of the misconception comes in. It also is, if it's not properly treated, and keep in mind, and both Taylor and Billy have talked about this, it's in any form where water is present. And that's even when it's considered to be aerosol, vaporized. And Taylor talked about the fountain. And that's exactly what a surveyor is going to go to when they're looking at your water management plan. When they walk around, I would identify those areas and start talking to you about your water management plan specifically in those areas, because those areas are often overlooked because they're just sitting in a waiting room. So even though Legionella can be present, though. It doesn't necessarily mean it's going to be contagious and fatal. It can be identified within your water system. The testing that they have now is so specific, it could take it down to very, very small elements where they identified Legionella. So that's where it's going to be essential within your facility that you're going to identify what levels do you consider are going to be a problem where you need to treat or you need to respond to it and come up with a corrective action and find some type of mitigation strategy. So that's another question that I get a lot of time is what are the levels? Well, Joint Commission hasn't identified them. CMS hasn't identified them. They've just given guidelines to where you identify what levels that you consider that they're going to be hazardous. Next slide, please. So let's talk about ANSI and ASHRAE 188. What ASHRAE did is they established minimum standards to be followed, and that's came out with this last year. And it also provides new standards for building design, building operations, and help minimize outbreaks. And it focuses on your water flow design. Additionally, identifies with your water systems what you should have in place, and it goes down to where it specifically identifies which components that you should be using to help minimize Legionella bacterium, and outbreaks. It also establishes processes that need to be in place to identify the presence of Legionella and how you're going to properly respond to the increase when you're doing your building systems. And it goes back to the point where it establishes new guidelines to where if you have a building that's new or it's been stagnant, they're saying you must at least 3 weeks prior, whether it's full or partial occupancy, work on your system, do your testing, and identify if Legionella is present. And then also, if you do identify that, you're going to have to come up with a corrective action. But they're saying you must do this at least 3 weeks prior. My recommendation is instead of doing the 3 weeks prior, because you're going to have your testing involved if you do identify it, do 4 to 5 weeks prior and then monitor the next 2 weeks. Also, it establishes individuals that can be used to follow guidelines. This is going to come back to your water management team. Like Taylor talked about, you can't have one specific individual anymore that's responsible for your water management plan. You have to have multiple individuals involved. Now, you can have one individual that's doing 2 separate areas. Infection control could be doing 2 separate areas on your water management team and being dual roles, but you can't just have one individual that's responsible for everything. Also with ASHRAE, they talk about the building survey process and the minimal guidelines to follow. And keep in mind, when we switch over to Joint Commission here on this next slide, keep in mind that ASHRAE 188 and Joint Commission standards are different. And I'll talk about that here in this next slide. Next slide, please. So let's talk about the Joint Commission standards. Well, what Joint Commission did is they focused on the foundation of the ASHRAE 188 standards. They didn't follow them to a T because they considered them more intrusive. And so that's why Joint Commission decided to focus on their foundational standards. So if you're going to pick a standard, don't say you're following commission because you're going to be surveyed to ASHRAE 188 standards. So Joint Commission standards are less intrusive. Now, that doesn't mean if you decide that you want to follow the ASHRAE 188 standards, that's fine. It's just when Joint Commission comes into surveys, your surveyor is going to ask, are you following the 188 standards, or are you following just the Joint Commission standards? Or if you identify it in your plan where you say you're following ASHRAE 188/Joint Commission standards, you're going to get surveyed to the 188 standards. So if you have that wording in your water management plan and you're not specifically following the 188 standards, you're going to want to remove that from your water management plan policy. So the Joint Commission standards, they narrowed them down to, it comes to EC 20502, and it's going to be EPs 1 through 4. And they focus on establishing a team that talks about providing a complete diagram. And as Taylor showed, she had an excellent example, and Billy talked about it as well. Don't get overboard on these. Just follow a simple process of what your water flow is when it's coming in from the domestic, how it goes in through your facility, and where it leaves. So it doesn't have to be, I've seen it to the point where there's been multiple pages where they're going through and actually identifying the sinks throughout the floor. That's very cumbersome. It takes a lot of time to do, and it also takes a lot of time to update when you do changes. So just keep it as simple as possible. Refer, when you're getting with your plan and you need some more guidance, refer to your CDC's water infection control risk management tool. It's a very effective tool. It's something that Joint Commission also accepts as well. And that helps you with your guidelines and going through your process. Also, with your facility, you're going to want to establish a plan for addressing stagnant water and process for monitoring protocols and acceptable measures. Again, this is perimeters that are going to be defined by your organization. Okay, if you have somebody that comes in, have a surveyor comes in and says, no, you have to follow these perimeters, that's where you're going to want to talk to the team lead, specifically with Joint Commission, because you're getting false information. Also, you're going to want to establish a process for identifying your risk areas, and then you're going to want to document your corrective actions. So you're going to want to have your plan, and if you've had any changes within your water management system, they're going to want to see the documented corrective actions. I wanted to see, okay, if you're doing construction, that would be the first thing I would start asking is about your water management plan and what areas have been effective, and I want to see what you're doing for corrective actions or what mitigation strategies you're working on at that time. And then last is EP4. This is another question I get. EP4 refers to additional information for guidance, but it's not required by the standard. So EP4 does identify 188. It does identify the CDC's water infection control kit or risk management kit tool. And then it also identifies a couple other articles that you can utilize for guidance. That's just for guidance. You don't have to specifically follow that. So that's another question that I get. Next question, or next slide, please. So let's talk about some mitigation strategies. Well, one, you want to determine within your organization what standard you prefer to follow. Again, this comes back. Do you want to follow 188 or do you want to follow just specifically the Joint Commission EOC EPs? And then ensure in your water management plan that EPs 1 through 4 are clearly defined. What I recommend is break them out into sections within your plan to be easily followed. So keep it as simple as possible. And so that way your surveyor goes down the checklist, they start going through, and as if they're following the process on the EPs 1 through 4, they're going to know which EPs and what to follow. They're going to have a template, they're already going to know it. And once they start going through and they get into 2 or 3 pages, they're going to know that you're going to have a complete plan. And that's going to minimize questions for you. And that's also going to minimize, confusion for your surveyor as well. So also don't state you follow ASHRAE 188 and Joint Commission standards. And I cannot stress this enough because this is a common problem that I come across when I'm looking at water management plans is they're adding both of them into because you're going to be surveyed to the most intrusive standard. I've talked about that on the two slides before, and I cannot stress that enough because that is one of the most common findings. And then also ensure your water management plan is reviewed annually like your emergency preparedness plan. It's not 2 years with Joint Commission. It's going to be required to be annually as well as your emergency preparedness plan to ensure any changes with the facility can be documented. And this also is inclusive of if you just reviewed your water management program and then you just went into an area and did some construction at the last minute and you had to change something within your water system, that has to be identified. And if that's different than what your water management plan says at the time, you need to change that. And then you also need to show that you have a documented corrective action. Next slide, please. So now we're going to go ahead and do a quick emergency management update for Joint Commission. Same with Billy with CIHQ. Joint Commission didn't do a lot of changes. They add a certain amount of wording that's been changed. So when you look at the new standards when they come out, it definitely looks different than it used to, but a lot of the same information is in there. But one of the biggest things you're going to notice is that the emergency management standards, they've been compressed into more detailed list. So you're not going to have as many EPs because what they've done is they've taken those EPs and they've compiled them into a list. So you're going to have less EPs, but you're going to have that same list where you still need to follow those guidelines. So you're going to want to adjust your emergency preparedness plan to meet the new structure of the standards in regards to if you're going through and you're identifying all the EPs, well, some of those EPs aren't going to be there anymore. So you're going to have to go through your plan and adjust that to what EP that's been moved to because they compressed the list. One of the big things that they're going to focus on, and this is specifically comes back to ransomware because there's been facilities that have been affected by this, is cybersecurity is going to be a focus. So with that, it's going to be added into the standards. It's under your HVA. It specifically details even further with cybersecurity what specifically you're looking for. And then also it's going to require your IT to be involved in the meetings and make sure that they can accurately speak how they're approaching the internal security within their system. And like I said, it comes back to ransomware. There's been a couple hospitals in Southern California that have been affected by ransomware. In one hospital, their exit strategy was they went ahead and paid it to be able to get their medical information back. Obviously, at this time, CMS is involved, the government's involved, and the hospital got some of their money back, but they didn't get all of their back when they tried to do the transfer. So that's happened to 2 hospitals down in Southern California. It's happened to hospitals in the Midwest now. And so that's why it's becoming a focus, and that's going to be a topic that's definitely going to be discussed during the emergency management session. Also, they went down and they detailed even more that senior leaders now need to have more increased involvement with establishing processes and contingency within your organization. In the past, what was happening was the emergency preparedness director or facilities director, whoever is responsible for it, they would just go through and plug in people that they felt would be a good contingency for the organization in case people were not available. Now they specifically want the senior leaders involved. They want to see in the minutes that the senior leaders were involved within that process, because senior leaders, they have found, weren't able to speak to it in the past. What would happen was emergency preparedness plan would get sent up to the governing board, they'd thumb through it, they'd sign it off. But when those specific questions started to get asked, the senior leadership wasn't able to answer it. Also, Billy talked about this as well. They changed initial training to be provided to all staff, and this includes your licensed practitioners. And you must not only provide the training additionally, or initially when upon hire, you have to also provide training every 2 years, and that has to be documented. So in the past, it was, the initial had to be done, and then the hospital kind of determined on what they were going to do in regards to updates. But now they specifically say, no, you need to have it every 2 years. And with Joint Commission, these standards are going to start surveying them starting July 1st of 2022. So people that are already coming up on it and you're in your window, go ahead and expect they're going to start asking these questions for you here. And this is going to be within a month and a half. Okay, well, that's all I have. Next slide, please. So if there's any questions, here's my contact information. You're more than welcome to contact me at any time, and we're available, well, all the time if you have any needs.
Fantastic, Lance, and greatly appreciate you being part of the webinar today and really giving the perspective from the Joint Commission with all these changes that are happening out there. And there's just been a lot of them. I tell you what, of all of the webinars so far that we've had this spring, this one in particular was probably the most in demand of all of them. And as such, we figured that there would be an ample amount of questions. And so I just encourage you, if you have a question, go ahead and use that Q&A button in the bottom right-hand corner of your screen. If it's not there, just place your mouse over it. It should pop back up. That's where you want to ask your question. And just to give everyone a couple of minutes just to formulate their questions, get them submitted, we're just going to run just a very quick video just to introduce a bit more about Soleran and what we do.
Hi, everyone. This is Grady with Soleran. I just wanted to pop in and say thanks so much for attending today's webinar, and I wanted to briefly introduce you to Soleran and ICM. Soleran has been developing software solutions since 2004. We've dedicated ourselves to developing an intuitive set of solutions specifically for healthcare facilities. We've also developed the market's only true ICM platform. ICM stands for Integrated Compliance Management. So what is integrated compliance management? Well, ICMs are generally comprised of multiple solutions designed to work seamlessly together within one platform. There's literally hundreds of systems and processes across multiple departments used to manage healthcare facilities. ICM is simply taking all of those solutions across all departments and putting them into one integrated platform. Having all your data in one place allows the system to automate many of your daily tasks, gaining better visibility, trending, and analytics. It actually does work for you. Soleran's ICM consists of 6 individual suites that include work orders, rounding, permitting, vendor management, project management, and security management. Each ICM suite consists of 4 to 8 different applications that can be used individually, but you'll see the most benefit when it's used as part of the entire suite. Of course, ICM's unique advantage is using multiple suites across the entire platform. Bringing this information together in one place across all departments gives you better visibility than what you've ever been able to achieve before across the entire hospital or even across the entire healthcare system. When your data starts working together across an ICM platform, you'll be able to visualize your data using new tools like the Compliance Survey Dashboard or the fully integrated Life Safety Drawing Manager. I know I went through this really quick and at a really high level, but we just wanted to introduce you to Soleran, ICM, and the tools that will ensure you're ready for your next survey. If you'd like to learn more, contact us at soleran.com anytime. We really appreciate you attending the webinar today and hope it's informative and useful for you to manage your facility better. Mike, back to you.
Fantastic. And if our speakers will go ahead and unmute and bring on their cameras, that would be fantastic. And so we have had questions coming in. And I think just before we even get started, just to let everybody know, so we've had a couple of questions in the chat just around the slides. And just to remind everyone, we're going to send out a link to this presentation. And so everyone should have access to those. And you'll be able to share that link with your colleagues as well. So that is actually really good news. And so just want to make sure everyone is aware of that. So let's do this. A few questions have come in, and there's more that's popped in, a couple of more even since then. But Taylor, let's just start with you. We had this question come in. What is the process that you use to educate your vendors on your water management program?
Yeah, that's a good question. Vendors usually what they'll affect is shutting down parts of the building. So we made, one of our directors in planning, design, and construction, he's part of our committee, and that's kind of his job to make sure that the vendors working on construction sites and shutting down parts of the building know what's expected. They have to flush the building when they do shut it down. So we kind of delegated responsibility to him. He attends all of our meetings and provides updates on current construction projects.
Very good. And I didn't know if Billy Lance, if you had any comment on anything related to that or not, just from your experience.
I think just from our standpoint, as you, especially as it relates to construction projects, just make it part of your pre-construction assessment before you're starting a project to make sure that if there's any plans for any shutdowns, that your vendors are aware of it and what your expectations are.
Got it. Yeah, that's great advice.
Yeah, I agree. I think that, the more you can do mitigation strategies up and, prior, and that should be definitely part of your PICRA is identified through there to where you can start on that process. That's going to be more beneficial than a reactive type situation.
Got it. And Billy, this next question actually kind of is similar and relates to it. And the question was, is there any specific risk assessment besides the CDC toolkit that you recommend?
Yeah, another great question. So want to preface this that the CDC risk assessment tool is kind of the national standard. So it's the main one that's evidence-based. It's the most well-known. So while there are probably many other risk assessment tools out there, even we at CIHQ have one available for our accredited hospitals. Even ours is based upon the CDC risk assessment tool as well and all their guidelines. So be careful when you do use and utilize a different risk assessment tool that may not be in alignment with the CDC, because the question you're going to get asked is it evidence-based? Is there a way to back up why you're doing it this way as opposed to what the national standard of the CDC is? So as long as you can back that up, and if it truly is evidence-based, comes from a national organization, something like that, then by all means use a different tool. But I've fared to guess that most of them that are out there, just because they come from a different entity, are probably all going to be based upon the CDC guidelines, but just be careful if you use one outside of that.
Got it. Yeah, and that's great advice. Taylor, Lance, I didn't know if you guys had any thoughts on that one as well.
No, I agree. I would just focus on, either the CDC toolkit, your accrediting agency, if they have a template, or ASHRAE would be the only other one that I would trust. So would be those three. Anybody outside of that realm, I would, those would be the questions I would start asking.
Got it. And so, but we have another question, but I want to kind of stay on the topic a little bit. I was looking through the Q&A, and there's a question that says, looking at the risk assessment that Taylor showed was interesting. This person tried a risk assessment to assess major equipment on a 1 to 5 scale. Question is this too deep? Should it be more simplistic? to alleviate a deeper dive by a surveyor?
I think, from my point of view, the risk assessment is kind of your facility as a whole and at what risk a patient is going to be at when they walk in your facility as it relates to the water system. We risk assess equipment and other things. So I would say that this risk assessment for your water management plan should be based on the water system for your building. I do think, risk assessing each piece of equipment is a little deep for the water management plan.
Yeah,
And I'd like to also, just being a surveyor myself, don't try to second guess a surveyor because you'll never do it. Everybody's different. There's no rhyme or reason to why we ask the questions that we ask. Make it useful to you. Don't make it useful to the surveyor. So it's your building system. It needs to work for you. You ultimately own it. Just be prepared if you do have somebody that asks more questions, just be able to answer them, but don't try to make it compliant to what you think a surveyor may ask. Make it reasonable and actionable for your organization. It needs to make sense to you.
Right. That is great advice. And there's another question, and again, and it kind of ties back into this thread a little bit. The question was, did I understand that we need to include our outlying clinics in the water management process as well? Did anybody have any thoughts on that one?
From our standpoint as an accreditor, absolutely. So it's anybody, and especially from the accrediting organization, if you have a building that is a clinic and they are a part of your application, you see patients that bill to your Medicare number, things like that. If it's a building that is surveyable, absolutely you need to include it.
Yeah. Taylor, I think you're going to make a comment as well.
Yeah, I definitely agree. We have a bunch of offsite clinics. We have like 50 across the Dallas-Fort Worth Metroplex. So we kind of assessed all of them, and the major one that we included was we have a dental clinic for pediatrics, and the rest of them are more therapy based. The only time they may use the water is to get a drink at the ice machine or something like that. But we really focus on the dental clinic because they're using the water there. They're there's a little bit higher risk. So we made a separate plan for that. And then you also have to think about our most of our clinics, we don't own them, we lease them. And so, we can identify the areas of risk, but there's not a lot we can do to force those landlords to do certain things. So there's
Right.
different factors you have to think about for those clinics.
Got it. And Lance, I think you're going to comment as well.
Yeah, no, I was just playing off what Billy said. That's exactly correct. Anything that's under your license, you got it. It has to be involved in your water management plan. That's the key element right there.
Got it. And we have a couple more minutes left. I'll try to get to a few more of these questions. Lance, I'll kick this one up to you. It says you talked about an attached building to the hospital and needing to be included in your water flow map. If your domestic water is in the same use as a hospital, does that include buildings that are overseen by a contract company?
Yeah, and I vaguely touched on that, and this is an excellent question because I can dive a little bit deeper further into it. So this is one thing. One of the changes also with your water management program is in the past with that. This is the only area that where that license kind of becomes a gray area. Is if you have an MOB attached to your hospital, but you're using the same domestic water source that it's going through and looping through into that medical office building, you have to now add that into your water management plan because it's getting to the point where it's touching the patients. And so even with a contract service, even if the contractor owns that building and you have a contract service and it's still a medical office building, but that water, your water loop is going through, you have to get them involved and you have to add that to your management plan. And I know for some people, that's going to be a kind of a tough situation to come across because as we all know, specifically being facilities directors over time, sometimes your contract services aren't as effective, and they're not given the resources that actually needs to happen, to be able to manage something like this. So that's going to be something that you'll have to sit down with them and really come up with an effective plan.
Yeah, that makes a lot of sense. I didn't know if Billy, did you have any thoughts on that one, or Taylor, what you guys are doing at your place as well?
Yeah, I agree completely with Lance. So, and just like Taylor talked about, it can be a little difficult for organizations, especially when they don't own the building and they're leasing it. Unfortunately, when you have a surveyor come into your facility and something's wrong, it's not the owner of the building that gets cited for it. It's the hospital that gets cited for it, and then you have to come up with a plan that way. So it's good to try your hardest, and I know it can be difficult. I've worked in a hospital before, and I know how difficult it is. Definitely try to develop that relationship with the building owners to where they understand what type of tenant they have and what the regulations and requirements and expectations are.
Got it. And then we did have a question that says, does Soleran software have water management plan templates? We do, and we can definitely talk to you about that as well. So I want to make sure everybody understood that. And I'm trying to see if there's anything else. And the question was if it was okay to share that risk assessment tool, which is, the appeal that was actually in here a couple of different times. And so obviously people are finding it helpful. So Taylor, I didn't know if you would be okay with that.
Yeah, if you want a copy, please just send me an email. I'll type my email in the chat just so you have it, and I'm more than willing to share it.
Got it. And then a follow-up then to the previous question about with the software. How do you deal with one building with 2 licenses? Is it expected to have one license plan for each license?
Motion detected at the.
So I'm not exactly sure.
Actually, Billy, this is one of your facilities, so I'm going to push this one off to you here.
Okay. Yeah. So you ultimately have to have one for each separately licensed facility. So if you've got 2 different facilities, there is the possibility that you're going to have different ways for the water to come in. But if it's the same, you just duplicate the same risk assessment. But yeah, you would need to have a separate one for each individually licensed facility.
Got it. Perfect. And a final question here, and we're slightly over. It says, as a disaster recovery management vendor, how do you recommend becoming a vendor partner included in disaster preparedness plans? Does anyone feel comfortable tackling that one? Or is that something that we need to get back with Amy on?
Could you read that question again, Mike?
Yeah, it said, as a disaster recovery management vendor, how do you recommend becoming a vendor partner included in disaster preparedness plans? I think that we can probably take that one offline unless someone has a good response to that one.
I have just a quick one. So, part of our emergency preparedness plan is that we have a contract with our local fuel vendor. Really, we don't announce that unless they specifically ask to see that contract, which we can show. That would be the only time we would specifically name a vendor, just because, if that changes, we use a different vendor, we don't want to have to go back and update it. But that's documentation I've showed in the past, is contracts that we have in place, MOUs, things like that, to provide services in an emergency.
Got it. That's great. Anybody else have anything to offer just from our panelists in regard to those questions at all, just before we go? Good. All right. Hey, that concludes today's webinar. I just want to thank Lance and Taylor and Billy for their time and for a great presentation that we can all benefit from. It was a great hour. So just a couple of reminders. One is everyone's going to get an email with a link to our future webinars. And we encourage you to share this information with your colleagues and tell them about our webinars. And go to Soleran.com at Think Tank to check it out and watch our other webinar recordings for great tips. That's a great resource there. In closing, we want to encourage you to use the Facility Compliance Think Tank Q&A and the group on LinkedIn to get additional questions answered by industry experts, just like we had on today. If you're interested in more information about any of the products presented during the video or at the beginning of the presentation, reach out to us by scanning the QR code. It's right here, and we would be happy to chat. And this concludes today's webinar, and it actually concludes this three-part series. Soleran and our speakers would like to thank everyone for joining us, and we look forward to seeing everyone next time. You guys have a great day.